To properly treat a burn, you need cold, potable water, antibiotics, non-adherent dressing, cohesive bandage tape, analgesics, and aloe.
Before treating a burn, put on PPE.
The first step is to stop the burning by dousing the affected area with clean water. Continue to douse or submerge the burned area for 10 minutes. The next step in treating a burn is to remove any jewelry. Be careful not to pop blisters that may have formed. The burn must be protected from infection and covered with a non-adherent dressing. Remember, don't pop blisters as they are easily infected. For more severe burns, antibiotics might be needed. Painkillers should also be given when dealing with painful burns. Once the burn has been treated initially, it is important to continue long-term treatment and monitor as needed.